Hi, my name is Jenna Nicoletti. I'm from Indiana State University. I'm doing this project on topic of OCD for my community health class. I'm currently in LPN to BSN program. This population at risk for OCD. OCD is diagnosed in population between late teen years and early adulthood. After this video, we should be able to define OCD, identify the cause and the symptoms, and the risk factors, and learn the preventions. And we should be able to understand the diagnosis and the complications, and know the treatment options, and we should know where to find the available resources. Now, please stop and click the link down below to take the pre-test to test your knowledge about OCD before we move forward. So, what is OCD? OCD is an obsessive-compulsive disorder. People with this disorder usually have obsessions such as repetitive, unwanted, and intrusive thoughts, and compulsions such as excessive urges to do certain things, even though you realize the thoughts and the behaviors are not normal, but you just cannot stop. So, what causes OCD? The cause is not fully understood, but it might be affected by biologically, genetically, and a learning process as a result of changes in your own natural chemistry or brain functions for biologic reactions, and genetics, even though the specific genes has not been identified. And you also learn from your family member over time. So what are the symptoms? You would struggle with repeated, unwanted, and persistent thoughts, feel anxious and being distressed by intrusive images and urges, try to act compulsive or perform rituals to stop, being obsessive with certain things, such as be fearful of germs or dirt, prefer things in certain order and being symmetric, have horrible thoughts about might harm yourself or somebody around you, prefer to know the plan beforehand, have a hard time to deal with the unknown, and cannot control the thoughts such as sexual aggression, religious subjects, use repetitive behaviors to reduce anxiety or intend to prevent bad things happen, such as keep washing your hands, keep checking the stoves, make sure it's safe. You'll always like to routine. So what are the risk factors? Studies shows that someone with a family history of OCD has higher risk to develop OCD, especially if someone is from your immediate family. Brain structure and functioning. Imaging studies show that people with OCD has different structures in the front cortex and subcortical. The connections between OCD and the brain abnormality were identified. Also, there's environmental factors. Some studies shows that the traumatic events in childhood are connected to OCD somehow. So, is OCD preventable? There's no study shows it is, but it's treatable. So if you think you might have OCD, get treatment as soon as possible can prevent. So how do we diagnose OCD? Psychological evaluation. You will discuss your feelings, thoughts, your symptoms with your doctor, say if you have OCD. Physical examination to rule out the outlying cause for OCD and to check for any other potential complications. And your doctor will use criteria in DSM-5. So what are the complications? Spend way too much time to do ritual and routines. Cause some health issues, such as if you keep washing your hands, you might get a contact dermatitis. And it's going to be harder to manage your work, school, and also social activities. We'll have hard time to deal with the relationships, and you might lower the quality of your life. And if it's severe, might cause suicidal ideation. Fortunately, there's some treatment available. First, we can talk to therapists about the symptoms and discuss the symptoms and the feelings with the therapist. And CBT, that would involve expose you gradually to the obsessions and compulsions such as dirt, or increase the resistance to the urge for the rituals. It's very effective for most OCD patients. And the medications always available for different. If it's chronic, there's intensive outpatient and residential treatment programs. They focus on ERP therapy. It works better if you struggle with severe OCD symptoms. The programs usually last several weeks. DBS, it only works for adults 18 years and older, which somebody doesn't respond to traditional treatment. And the TMS only works for adults 22 to 68 years old, which also someone doesn't respond to traditional treatments. I have some available resources here, such as International OCD Foundation, NOCD, CDC, and NAMI. They are get help for OCD. And I also have some handouts available. If you want to click the link down below, you can get handouts. Now, if you can stop the video again, just click the link down below to take the post-test, see how much you learned from a video. Here are just the resources. Thank you so much for listening.